Hey, can you guys hear me and see my screen?
We got you.
Yeah, you're
Sweet.
good.
Awesome. So for those of you who have not met before, just a little bit about me if you ever want to get in contact. But one of the things I always love to do is, just like Karen, I also have 4 kids. Somehow we all managed to create just a bunch of boys. So I have 4 boys. Just imagine my poor wife who is taking the brunt of the childcare duties as these hooligans stay at home. They go from 8, 6, almost 4, and 2 years old. So it's a lot of activity at the Davis household. And then a little bit about just Karen and I doing some of the ATUG stuff. We had our 10th anniversary earlier this year in January, and we had nearly 300 people join us for that, which was super fun. And I don't think we definitely appreciated it at the time, but I don't know how much we knew that that would be kind of our one of our last group gatherings for some period of time. So we look forward to having everybody back together. A couple other things I'll mention. Your phone, we do some QR code type of stuff here. And for those who were in ATUG and we're here for our March, we had the idea of, hey, let's do a book and do a quick book club together. Not necessarily something that's related to visualization or data, but just something that will be encouraging to us all in this season that's happening right now. And so we about 30 of us kind of read this book, and nearly 20 of us got together and had a little virtual book club on a book called Shackleton's Way. And from the folks who did it, we had a ton of great feedback, and we kind of walked in and said, hey, if this is good, maybe we'll do it again. And so one of the things I wanted to share with everybody here today is we are going to do this again. We've had a post up on voting between these 4 books. So we're probably we thought about closing it down, but the challenge for us was that the voting was actually really close, and so we've got still some responses to see who's going to ultimately be our winner. So would encourage if you all are going to be available on May 14th is when we're going to get back together, 3:30 to 5:30 p.m. Eastern time. Take your phone out, scan that QR code. That'll take you to a Google form. Let you kind of vote on which one of those books. If you're not familiar with them, just check them out on Amazon. Each one is actually really interesting, but for different reasons. So love to have that happen, and we'll get another one of these virtual book clubs going. The last thing that I'll mention to you real quick too is, and I've got a QR code for this as well, but if you want to follow along or download what we're going to do today and just play with it some more, I updated the data for it earlier today. So you just go to my Tableau public, Nelson Davis, you'll see the COVID-19 training workbook, and you can kind of check that out. We'll update the data for that every so often, but you feel free to do that. I love it. We got 4 more responses already. Real time, baby. This is awesome. All right. So with that, what I want to do is hop over to Tableau. And so here's the QR code. If you want to go get this, if you want to go to my Tableau public, it's right here. The other thing I'll mention to you real quick as well is that we got the idea of exploring this COVID data, and we did a training for a group of students at Georgia Tech here in Atlanta. So some Masters of Analytics students, MBA students, a handful of others. And so that was kind of the initial impetus for some of this. And we had such a great response. We had over 60 people who did that. We thought it'd be really cool to just open that up to the public. So if you're seeing this today and you're like, man, this is super cool, but I want to dig farther into it, what I'd tell you is QR code that little guy. That'll take you to a little event that we made. We're trying to figure out how to do this and to put our team's info, but we're not blasting it all over the internet. So we put a little something on our website. So QR code that thing. You'll get an email response. It'll have the team's meeting in the email response. If you don't get it, just check your spam folder because it was in my spam folder. But hopefully this works. And if you have any problems, just reach out. You've got our contacts. So there we go. Super excited and about all that. So one of the things that I want to be super thoughtful about, a couple of things just on the front end. The first thing I want to say, That said, I have done epic work twice with the foundation on some really critical epidemiological data. The first time I did it was in the end of 2014, the beginning of 2015. We worked with the World Health Organization and the government of Guinea during the Ebola outbreak to help them do the analysis around the contact tracing work. It was myself and two other guys at Slalom, which is where I was prior to this. And you know, kind of nights and weekends type of stuff, and trying to build something super fast. And I ended up building kind of the main kind of KPI 7-day tracker around, you know, how many people have Ebola and how many people were doing our contact tracing, who are we missing, and so forth. And so just super impactful for the opportunity to do something like that. And shortly thereafter, I actually had the opportunity to follow that up with doing another project with the Tableau Foundation around Visualize No Malaria, a project with the Bill and Melinda Gates Foundation, PATH, a couple others. And the focus there was, you know, can we eliminate malaria in Zambia? And so I actually got to go to Zambia in 2016 and a couple other things. So like, it's doing epidemiology is super cool to me. Like I have a passion for this, and it's been interesting. I never anticipated ever doing any of that analysis domestically, but here we are, right? So one of the things that you have to realize, though, if you're going to do any type of analysis on this type of data is this data is human beings, right? And so we want to have the right posture, we want to have the right mindset as we go into any analysis that we're doing. Is you're looking at bar charts and dots on a page and so forth, but you realize that these are human beings. These could be your neighbors, it could be your parents, it could be your grandparents, and so forth. And so I just want to be really clear that you just want to treat the data with a lot of dignity. The dignity of that these are people who are suffering, and it's people from all over the world. And again, it's the people that live down our street. So just want to mention that from the outset, that this is a big part of you know, how we need to approach the data. Tableau has done an amazing thing. They have gone in and allowed us to access some of this data. You've got Tableau created that the COVID-19 data hub, and again, if you go get the workbook, all these sources are here for you. But I wanted to call out basically the idea of this talk, and what we're going to do rapidly together is to kind of show you some of the cool things that other people have done to hopefully create some of the insight here around you know, how to illuminate what's going on in COVID. And so I wanted to show a handful of different pieces here. One of the ones that I think has done a phenomenal job of explaining how we flatten the curve was Washington Post article that came out pretty early on, so kind of March 14th. It helped me really understand, okay, what are we talking about, and why does it matter so much? Fascinating as well that what, 33 days ago, we had 2,000 cases of COVID. We're over 600,000 of them in the United States at this point. But it was just amazing to be able to walk through this analysis and kind of understand what happens and why it matters so much, and how social distancing works and so forth. And so I love this because it's just really helpful from a data storytelling perspective to understand what's going on when we talk about social distancing and why it matters, and why growth, unabated growth, becomes exponential, right? You can just begin to see what's happening here. You know, the one person infects one person, and then so forth and so on, and things escalate very, very quickly over time. And I won't go through this whole thing. Definitely encourage everyone to check it out if you've not already seen this. An absolutely phenomenal opportunity to check this out. Another one that I loved a bunch was this National Geographic article. Always want to look at the past and learn as much as we possibly can around, again, the concept of flattening the curve, and the way that they talked about the different shapes. Look at you. And the different shapes that you had in the different geographies of the United States. And you know, it was interesting to me that, you know, Philadelphia was the huge spike. New York was much more gradual, even though, of course, the populations were very different even back in 1918. But it's also interesting to see what was the duration of the social distancing measures. How did the different geographies play with each other, or, you know, learn from each other, do things differently? You know, you have some that went back to social distancing when they saw a second spike, some who didn't. It'll just be really interesting. We know that second spike is going to come, and so forth. So one of the things that, as we dig into the Tableau data here, one of the things that we wanted to be able to do is just kind of talk about the concepts um, of what do we talk about when we say flatten the curve? What does that really mean? And so what I've got here is I've zeroed in into the United States, and I'm looking here at taking, in this data set, we have a running number. That's just our total cases, or we can do kind of a day-by-day addition. And it's also worth noting as well that we have kind of a type. So we have case type here that I just drag over. For the moment, we're just going to look at the confirmed cases. And what I've done is just taken quickly just the sum of the difference, and that's basically just kind of giving us the number of new cases that we have. What I was able to do really rapidly was, just using a quick table calc. So I'm holding down kind of a control, left click and drag, which kind of is a copy paste for me. I come over, and what I want to do is just kind of do a moving average. And this is pretty noisy. We do definitely see a trend, but it's better for us if we can kind of say, hey, let's do kind of a 7-day moving average and see what that looks like, right? And so if I wanted to do a 7-day moving average, I would not type 7, actually, I would type 6. So look at the previous 6 values, and then do the current value. What I get with that is a nice kind of smoother curve here. And what is helpful in this season is to be able to see that, yes, indeed, what's happening now is that we do see that at some point in the last few days, kind of April 10th, as a general rule, the United States is beginning to see a decline. Now, one of the things that I know about the United States is that New York is really dominating what's happening here. And so one of the things that I might be able to do is I might want to go and see specifically, hey, what's going on in New York, and kind of check them out. And one of the things that allows me to do is kind of say, okay, it's helpful because I'm seeing that New York is also kind of on a downhill slope, both here in the noisy data, but a big jump yesterday. So that's discouraging. But we are seeing overall a lower trend. But I also think one of the things that Tableau is phenomenal at is, well, hey, if New York's such a big driver, what if we exclude New York? Are we still on a downward trend, right, when it comes to, again, flattening this curve? And we do see that we are, but it's not quite as significant as it is otherwise. So, this is just a quick way for us to kind of, when we talk about flattening the curve, this is, we're talking about the number of new cases that are coming in. A couple other things that I wanted to highlight, and I know we've, as we mentioned on the front end, we've intentionally we're trying to go pretty quick through some of these things so that we have a chance to hear a lot of folks. Another great kind of resource, the USA Facts data is out there as well. But one thing I wanted to bring to everybody's attention, let's see if I can find it real quick. Nope, hold on one second, sorry guys. Nope, one more. There we go. All right, so this visualization is not one that I did, but it was a winner of Visit the Day the other day. I want to say back maybe late March. See, I've got it pulled up right here. So this is from March 27th. And this was published by Overflow Data. So I want to give them all the credit in the world for doing that. I didn't put this together. But one of the things that I knew was we had the COVID cases and deaths down to a county level. But I didn't want to go solve the problem because I was lazy of figuring out how many people were in each one of those counties. And then I saw this and I realized that, oh man, they've already solved that problem. And so all I really need to do was kind of blend into that data. And what it would give me is the ability to do a metric that's really informative when you talk about epidemiology. So the metric here is looking at the incidence per X number of population. In this case, because it's the United States, and because we don't have just massive infections as a percent of our population, we're looking at per 100,000 population, which basically is to kind of say, if I were to see that metric and, we basically have 1,000 cases per 100,000, that's equivalent to basically saying we have 1% of the population of that area has tested positive as being infected, right? And so one of the things that we've, I think, all kind of come to love about the newer versions of Tableau is the animation piece. And so I just want to kind of quickly play a little bit of that and show that, as things were kind of ramping up, through the beginning of March, there's really not a whole lot going on, but you begin to see a handful of places. And also to kind of call out, the way that I've set the coloring up here is you kind of have that light green up through having 100, 100 incidents per 100,000 pops, so kind of 0.1 of the population. And then you kind of get into a deep orange and dark red as you get into 1,500. So basically 1.5% of the population. So it's allowing us to have a quick way of seeing some of the hot spots here in Atlanta. We've had a big focus on Albany. Many of you, I'm sure, have not ever heard of Albany before, but Albany is in kind of southwest Georgia, and they've had some real challenges, and their healthcare infrastructure has been overwhelmed. I think they're in a stage now of being able to recover, but when you look at the percent of the population that has tested positive, it is really staggering. All right, couple other things, and then we'll open up for questions in just a second. So one of the articles that I found that I thought was really informative as I was first digging into this data and kind of thinking, hey, this could be interesting. This article was written on March 22nd, and what it showed was, hey, the United States as compared to Italy. And some of you may remember, the kind of saying Italy is 8 days ahead of where we are, and this was kind of taking that assumption. And the idea of this was, hey, we don't want to be Italy. We need to do some things, right? And kind of the title of the article was, why we're not overreacting to coronavirus in one chart. And so the thing that I would show you here is that you could see, the United States kind of started slower, but then ramped up much faster. And then, it was kind of interesting to see what was going on there. And so I'll show you, I took this same data set and basically recreated that visualization there. And the one thing I'll say that is the most technically challenging piece of that is that you need to write a level of detail calculation to understand what was the first day that the country surpassed 100 incidents. And so that, for me, that's just right here, writing this, at the country region, which is basically United States, Italy, whatever. If the country daily total is greater than the starting point, and my starting point is 100, then give me the date and take the min of that. So that just kind of writes down for all the rows in the data set what that initial date was. And then all we have to do from there is kind of say, hey, how many days has it been since that initial date? So it's just the date minus that day one. And so it's day one and not day zero. We just add one. So this was kind of what things looked like, as you saw, and then you just kind of bring it forward a little bit, right? Kind of one by one. You just kind of see how, at least kind of remains in front for a little while. The challenge, though, of course, is that we began to escalate, right? And escalate and escalate and escalate, right? And this is when we're back at, kind of 150, 200, and look at Italy kind of leveling off. And then these are the last few days. And then this is kind of where things were yesterday, right? So again, kind of a fascinating, not a logarithmic chart by any stretch, but a fascinating way of looking at this data. And if that original visualization could kind of be updated in real time, that's kind of what you'd see there. So one more thing, and then we'll kind of open it up. There's a great video on how to tell if we're beating. Basically, I'll just kind of randomly walk you through the concept. I encourage you all to check it out, which is basically saying, hey, we're in an exponential growth period, and we had been, certainly when this was cast. We're now kind of slowing. The idea, though, is that exponential growth is really hard to understand, and what we really want to understand is, when do we break out of exponential growth? And so these guys came up with a way of understanding, hey, when does that happen, and when can you see really easily when some of these things are happening, like when some of the countries are breaking out of exponential growth. And so we thought that would be an interesting one to do as well. And so again, what we're going to do is, and I won't go through all the nitty gritty on this, but we basically created, again, a 7-day average around the new cases. And then we're doing that in in conjunction with looking at the total number of cases over time, and we're putting them both on logarithmic axes. And if you're not familiar with how to do logarithmic axis, it's okay, because you probably don't normally have to. But if you just right-click on your axis over here, open that up, you get into the logarithmic piece, you just check that box, and that's what gives you the logarithmic axis. And so the idea is that basically as countries are going up exponentially, you see them go in basically a straight line. When they begin to break out and when you begin to see kind of a curve, you begin to kind of tilt down. That's when you know you're beginning to slow down. You're not, your growth is not exponential at any point, or any longer exponential. So what I'm gonna do is just kind of play this and kind of watch this. Let's see if that works. I didn't like that. Oh, I see what's going on. Hold on a second. So this is bringing all these dots, and we've highlighted a handful of them and given them names. And so you can kind of see how everybody's kind of moving up that exponential curve, and kind of see, you know, for the most part, a lot of them are kind of curving out. And you can also see that, you know, obviously we've separated ourselves from the pack, unfortunately. But even we, as we saw kind of in the beginning of this, we're beginning to break out of that exponential curve. So again, I think there's a lot of good news. The challenge for us now is that if we focus only on the United States and we look just at the states, I think it's becomes a little bit more interesting as well there too, right? Shoot, hold on one second. See if we can just do this in real time. So if we were to replay some of this stuff, I think you've got a lot of the states that were kind of tracking there, some of them slowing down. And again, this is not the greatest way to see those all the different initial slowdowns, and we've got all the different names and whatnot, but you've got some that are still, you know, South Dakota has kind of come into the microscope recently, but you're seeing a lot of the states beginning to kind of come off of that exponential curve. So a lot of good news as far as breaking away from the exponential. So I think I've talked over my time. The one last few things that I would leave you all with is, again, if y'all want to do more of this, and what we're going to do is kind of do a hands-on type of thing and go through some of these same things and talk in more detail on how we built them for about an hour and a half, and then kind of open the floor for 30 minutes and ask any questions. We want to be able to talk also about like how this is affecting businesses, how is this affecting supply chains, how is this affecting all sorts of stuff, and just kind of have a question answer there. So there's that QR. And then again, we'd love to have folks join us for that Lit Leaders. And again, pencil that into your calendar. We'll send you an invite shortly around this, and I will shut up. Sorry. Any questions? I'm sure there's none.
Hey, Nelson. So we do have a couple questions.
Sweet.
Is there a way to RSVP to the COVID dashboard demonstration without using the QR code that you just showed?
Yes. If you go download the workbook, let's see. I don't know if I made. Oh, yeah, I guess you can. See if I made that bigger. Again, we put on our website for the sake of speed. We want to be able to not just blast the internet with the Teams meeting and have everybody bomb into that. So that's the only reason that that's there. But you'll get an email. If you don't get an email, immediately check your spam folder because it was spamming me. So feel free to check that out.
Yeah, we'll see if we can get that link into the chat window here for everybody.
Oh, yeah, I'll do that.
Okay, so one question from Keith is, why don't we show average cases per million instead of total cases? Isn't that a better way to compare countries since populations are so different?
Yeah, it's an interesting question. That's why we go back. A great question. You're spot on in a lot of ways. That's why, particularly when you get into the epidemiological focus, you do get into kind of a number of incidents per X. When we were doing the stuff in Zambia, we were looking at it per 1,000 because malaria is very prevalent. But you know, with it, you just kind of want to think about what's the right scale for being able to color. And again, the goal here is to understand where we're seeing a tipping point, where we're seeing that things are happening, and being able to dive into that and using the visual layer to help us see that. So hopefully that makes some sense.
Sorry, I was
Yeah.
muted. All right, so Theodore had a question for the Italy versus US comparison. Wouldn't you
Mhm.
want to compare percent of population with COVID instead of the actual infections? That's basically the same answer, right?
It is, so it is a little bit different right at the very beginning. And so there's definitely once you're kind of in the middle of it, it makes a good bit of sense at that point to be talking about it in comparison to the population. But when you think about the beginning, you're really focused simply on the speed of the spread. You kind of, I go back, maybe the best way to kind of even explain why I would say that is back to this, right? In the beginning, let's see if I can hit reload on this. In the beginning of an outbreak, you've got, kind of a single point, and then that person or, that single point is infecting other people, and it's very point to point, and you have that very exponential spread. And it just depends on how many points. You don't necessarily have it all over the place. Now, because we're in the middle, but now we're trying to bust the curve, it makes a lot more sense to be looking at things in terms of incidents per X population. But in the very beginning, just pure number of incidents is actually very informative. But it's your shifting metrics as you go through it. It's a great question though. But yeah.
Cool. So last question about the data access. So how are you making them real time? Are you using APIs to fetch the data with Tableau? How are you getting to the data?
Yeah, I will, let's see if I can pull up my Alteryx workflow here. Uh, you, Nathan, you of all people know that we have built a little
Yeah.
Alteryx workflow. This was as a part of a project that we did for another one of our clients. And so we just kind of borrowed that. What I will say though is that the data is coming from John Hopkins. So if the only challenge that I don't know if there's a good way to do the download piece in Tableau Prep. Otherwise, I would tell you could do that. But the CSV that we're downloading is the same one that everybody else is using. We just didn't want to hit it live because we found that to be unreliable. So what we do is we hit this and publish it to the Tableau server for our client, and we kind of just refactor it every so often. So yeah, hopefully that's helpful.
Awesome. Yeah, so we're actually getting that data through data.world from Johns Hopkins. They made that available there. It's pretty great. So Christina Kempo asks a question: is there a way to show how to factor in test availability? She's wondering if there's a way to track the number of tests administered into the evaluation.
Yeah, it's such a great question, and particularly right now, one of the things that when we did this the first time, we were very cognizant of the fact that you are seeing some leveling off of the number of cases. The problem that you have with it is the fact that you are also seeing a leveling off in the number of tests, right? And so if there's a somewhat known percentage of tests that are going to be positive as you're administering them, well, if the number of tests levels off and the number of cases levels off, there's probably a high degree of correlation. What we need to be seeing is that the tests continue to dramatically increase exponentially, and that the number of positive tests comes back. That begins to that also decreases, right? So you want if I go like this, right? So that your testing continues to increase exponentially, but that your number of new active cases begins to turn the other direction. That's when we know truly that we really have gotten through kind of the height of the curve. But simply because the fact that we're not testing, or our testing is not keeping up, we may be seeing that there's some flattening that's false. So something for us all to be thinking about.
Awesome. We got one last question. Thinking about predictive analytics with this data, have you done any? If you haven't, what would you do given some time?
Yeah, such a great question. What I would actually say is I have not, and I have intentionally not, and I would discourage anybody who's not an epidemiologist to not. You are not, you didn't go to school for 4 years, you don't have a PhD, you didn't necessarily study all this. Unless you did, then by all means go for it. But what the last thing you want to do is kind of do your own model and be like, hey, I'm smarter than all these epidemiologists. It's just not, it's for me personally, again, I treat this data with such kind of a posture of honoring the people and trying to be really, really thoughtful about the proper uses of this. for me, this is not it's not an opportunity for me to take a statistical model and to try to become an epidemiologist in the season. I trust those that are in charge who are doing that to do this. If you feel differently, obviously go for it. I would not go after that, but obviously there's a ton of content and a 1,000 Medium blog posts that you can go read about other people who've done that.
Awesome. Well, that's it for Q&A. Thanks, Nelson.
Awesome. Yeah, thank you all. Really appreciate it.